Hello, good evening, good morning, wherever you are. Good afternoon, it's another fine day. We are continuing with our talks and topics that we always go through. We are finishing today disorders, depressive disorders today, and we will go to other things from I think after tomorrow. We continue with other mental health issues. Today is a good day that we are going to deal with other conditions that go hand in hand with depression. There are so many conditions that go hand in hand with depression. A person suffering from other diseases that may cause depression. I pick some of them and we go through how depressive disorders are brought about by other conditions. Today, it will be a short session, but we will see because some people have other issues that bring depressive disorders and they don't know the issues that they are suffering from are the ones which are bringing depressive disorders. So today we will see other diseases that we will categorize them like neurological disorder, infectious diseases, endocrine diseases, cardiovascular diseases, autoimmune and inflammatory conditions, and others that we may see. Now, in depressive disorders due to another medical condition is a type of depressive disorder which is depressive symptoms are directed by a medical illness or psychological condition. You see, it is directed by a medical illness or psychological condition. You see that disorders medical condition is clearly responsible for the mood disturbance. You see, the medical condition is the one which is causing the mood disturbance. Now, we continue and say prominent and persistent depressive disorders such as depressive mood. To diagnose, you remember, to diagnose a depressive disorder due to another complication, even from the start. We started by checking symptoms of depression from the person. You see, started by checking symptoms of depression from the person. Which are these symptoms that we may look at and say, this person needs help. This person is depressed. These are symptoms like depressed mood, loss of interest or pleasure, feeling of worthlessness or guilt, fatigue, changes in sleep or appetite. Sometimes we saw appetite may be gone. Sometimes other people have hyper. You see, you eat a lot. Yes. Poor concentration or indecisiveness. You are not concentrating. You are not concentrating on what you are doing. You are out of space from other people. Suicidal ideation, ideas of suicide. Yes, those are the symptoms that you may find a person having when this person has other conditions and they are causing depression. We are talking about mental health, and mental health is all about the brain and thoughts. Now, number two, evidence of disturbance in direct physiological consequence of a medical condition. Evidence of disturbance is the direct physiological consequence of a medical condition, such as laboratory finding, history, examination, and physical examination. You get it? Evidence of disturbance is direct physiological consequence of a medical condition. You feel disturbed with the symptoms that I've gone through, and then you find this is a disturbance with some laboratory findings like you go to the lab, you have done some tests, and then you find out that you have this condition. It comes out clearly that maybe you have another medical condition that is making you being mentally disturbed. There is physical examination when a doctor does the physical examination to find out what is happening. Number three, the disorder is not better explained by another mental disorder, e.g. adjustment disorder. Number 4, symptoms cause clinical significance or impaired in social, occupational, or other areas. You see that? Now, this is, you are displaying symptoms of depression, but symptoms cause clinically signified distress or impairment in social, occupational, or other areas, not due to substance. This person has not taken any substance and like alcohol, drugs, abuse, no, but this person is displaying symptoms of depression. Medical conditions that may cause this. What are these medical conditions that may cause depressive symptoms? You see, they are categorized. This medical condition can cause depressive symptoms due to their effects on brain function, metabolism, immune system, or hormonal regulation, how your hormones are being regulated. And that's why from the beginning we started discussing how the brain works, how neurotransmitters work, so as we understand how to go on with hormonal regulation. Now we are talking about diseases. How are they categorized? These diseases that may cause someone to get into depression and start thinking of mood, suicidal thoughts, and ideologies. You see, one, they are categorized in neurological disorders, infectious diseases. Diseases can cause endocrine and metabolic disorders, cardiovascular and pulmonary. We will go through them. We see autoimmune and inflammatory conditions, and others like cancers. Now, what are neurological diseases? Neurological diseases are like stroke. What is stroke? You see, we ask ourselves, what is stroke? Stroke is a medical emergency that occurs when the blood supply to the part of the brain is interrupted or reduced, depriving brain tissues oxygen and nutrients within minutes. You see that the stroke can cause permanent brain damage, disability, or death if not properly treated. You see, one, we have ischemic stroke. Ischemic stroke is when is you are ischemic stroke is when your oxygen are down below 87% caused by a blood clot, blockage, a vessel in the brain. You see, when you have a clot in the brain, then the blood is not reaching some centers, the oxygen will not reach there. So it will have ischemic stroke. Thrombotic, a clot form in a artery supplying the clots. Embolic, if it is not thrombolic, you will get an emboli. An emboli, a clot forms elsewhere, e.g. the heart, and travels to the brain. You can form a clot in your heart and it travels, it reaches the brain. It blocks some valves in your brain lacks oxygen to some parts, and then you get stroke. You see, there are some partial and complete stroke. Yes, number two, types of stroke. The first one was ischemic. The second is hemorrhagic stroke caused by interrupted, ruptured blood vessel. Your blood vessels can rupture, leading to bleeding. You bleed a lot, and then you don't have the red blood cells that are transporting oxygen and some nutrients to your brain. Can cause high blood pressure, aneurysm, or tumor. You see, now when you are bleeding in your brain causing stroke, there are two types of bleeding. They are called intercerebral hemorrhage inside the cerebrum, bleeding within the brain tissues inside, and then there is subarachnoid bleeding, bleeding into the space between the brain and the thin tissues covering it. It's this one can bring stroke. You see, subarachnoid, you have been hit by something and then you start bleeding from inside. And then we go number three. Which type of ischemia is this? Transient ischemic attack, which people get so fast. Nowadays, people get transient ischemic attack so much, also known as mini stroke. You find part of your system is not working well. How does this come about? When you find that part of your system is not temporary blockage of blood. Symptoms can lead to from less than 24 hours, often resolving in minutes. You see that those are the three type of stroke that you can get: ischemic stroke, hemorrhagic stroke, and transient ischemic attack. Symptoms of stroke. What will you look at and know that this person has stroke? One, face drooping. You will find the face is drooping. You will find this person is not okay. The face is drooping. Arms weakness. The person is weak. The speech is sluggish. Time to call emergencies. You see, this is the time you really need to call an emergency. Yes, yes, yes. We continue. Other symptoms that you may look at and know that this person has stroke: confusion or trouble or understanding speech. This person is having confusion and trouble understanding speech. Hmm? This person is always having trouble understanding speech. Sudden vision problems. Sometimes you cannot see well. Dizziness, loss of coordination. Yes. Sudden severe headache with no known cause. You just have headaches because you're not getting enough oxygen in your brain. Now, factors for stroke. These risk factors for stroke are like hypertension, diabetes, smoking, high cholesterol, atrial fibrillation, palpitation. You see that obesity, large bodies, you may get a stroke. Physical inactivity. You don't go to the gym, you don't work, you can get a stroke. It's excessive alcohol. Taking excessive alcohol is not good. You can get a stroke. Now, non-modifiable, those that you cannot change. You see, like hypertension, that one you can go get some medication and then you are okay. Diabetes, you can get some medication to control. Smoking, you can stop smoking. High cholesterol, you can get some statins and reduce the cholesterol. Atrial fibrillation, you can get a drug and help them. Obesity, you can lose weight. Physical inactivity, you can stop being lazy and then you hit the gym, you walk, you stop driving all around and then you are okay. Excessive alcohol, now you can change your lifestyle and stop taking alcohol and then you are okay, but you cannot change your age. Risk increases with age. Yes, you cannot change your age. So it's better to start working out earlier rather than waiting when you are old, then you start thinking about that. Family history. If your family has a history of stroke, you get it. If your family has a history of stroke, you should think about working out, doing some things that may not predispose you to these factors that you have said, risk factors like physical exercise, obesity, smoking, diabetes, high cholesterol. You see that, and excessive alcohol. Yes, gender. Mm? Men are at high risk of stroke than women, likely to die from stroke. So gender you cannot change. Race, higher in risk in African descendants. You see, how do we diagnose this stroke? CT scan or MRI. You go get a CT scan, MRI, you check your brain. If it is having it, we control, we try to help you out. Blood tests, yes. Blood tests like cholesterol, lipid profiles, all those we test. ECG, carotid ultrasound, echocardiogram, we do them. How can we treat stroke? Stroke it can be treated by ischemic stroke. You see, within 4 hours, 3 hours of symptoms onset. Mechanical thromboembolism within 4 hours. Embolism, we remove the clot. Antiplatelets, we use aspirin, we see aspirin 75 milligrams and anticoagulants as an anticoagulant, and there are some other anticoagulants that we use like heparin, warfarin. Those ones help, but under prescription from your doctor. Hemorrhagic stroke, bleeding, we stop the bleeding in the brain. Surgery may be needed. Yes, an aneurysm or a hematoma. We do a borehole, we remove we remove that clot that is there, or the hemorrhage that is there. Avoid blood thinners, even if you are giving you when you have a problem like a clot. Let the doctor prescribe. How can you prevent? Control the blood pressure and diabetes. Stop smoking. Smoking brings very many things. Health, diet, and exercise. Treat Atrial fibrillation with drugs. Limit alcohol. Alcohol is a bad thing when you take it excessively. Take prescribed medication consistently as per your doctor. We go to the next thing, which is Parkinson's disease. Now, what is Parkinson's disease? What is Parkinson's disease? You see that those are neurological disorders that may make you have depressive disorder. What is Parkinson's? It's a chronic progressive neurodegenerative disorder that primarily affects movement. It results from the gradual loss of dopamine production in the neurons in the substantia nigra. It's inside the brain, a region of the brain that plays a key role in motor control, in your movement control. So Parkinson's is a progressive neurodegenerative. It destroys your neurons and your nerves slowly by slowly in the regions that control motor control. Cause and pathology: dopamine deficiency. The hallmark of Parkinson's disease is loss of dopamine in the basal ganglia. We talked about the basal ganglia, particularly in the substantia nigra and parts of the compactor. Yes, in the part inside the basal ganglia. You see, Parkinson's, you cannot control because they die slowly. You see, the causes. What are the causes? The causes are maybe unknown, maybe genetic mutations, environmental toxins are maybe the problem. Parkinson's, it disturbs so many people. Drug-induced antipsychotics like haloperidol, they cross the blood-brain barrier and they go to your brain. So when you are using drugs, be very careful on use of drugs. It's not good to use drugs. They may make you destroy the basal ganglia, then you start having degenerative disorders. You start having issues with your brain. Now, symptoms of Parkinson's. We are talking about issues that may bring you to disorders of depression. And we have talked about the first one, we have talked about, which is stroke. We are talking about Parkinson's now. Symptoms may be, what are the symptoms of Parkinson's? Tremors, rigidity, stiffness, akinesia, bradycardia. You see, slowness of movement. You are very slow. Posture instability. Late stage symptom, posture instability, non-motor neuron. Those ones that are not seen by movement are these ones. Those ones that I've said, they are seen by movement. Loss of smell, anosmia. Sometimes when you have Parkinson's, you may not have sense of smell. We call it anosmia. Sleep disturbance. You cannot sleep well. You are always up, 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 up. You are when you take food, there is constipation. Digestion is not working. Depression, anxiety, cognitive impairment, and dementia. You forget everything. Late stage. This is comes at the late stage. And then autonomic dysfunction, orthostatic hypotension, urinary incontinence. Sometimes you don't go to the loo well. You see, so the treatment, we replace the dopa. We buy drugs that can replace the dopa, like levodopa, dopamine antagonists, and some antidepressants, anticholinergics. You see, sometimes when the brain is having a problem, what do? We do deep simulation surgically and supportive therapy, speech and occupational therapy, nutritional support, and psychological. Now, the next one we are talking about is multiple sclerosis. Multiple sclerosis. Multiple sclerosis. What is multiple sclerosis? Let's see what is multiple sclerosis. Hmm? Like uh, this is no, we go to epilepsy. What is epilepsy? Epilepsy is the second one. Epilepsy is a disorder. Epilepsy is a chronic neurological disorder characterized by recurrent and provoked seizure. A seizure in a sudden surge of electrical activity in the brain that can affect behavior, movement, feeling, or consciousness. Epilepsy. You ever have a person having a seizure? Don't say it is epilepsy, because seizures, they come When you can have high fever and you have a seizure. You can take a drug and you have a seizure. So epilepsy is diagnosed when you have specific things. Yes, chronic one that cannot be known. Epilepsy can be idiopathic or secondary to other conditions like genetics, brain injury or trauma, stroke. Yes, we have talked about stroke, brain tumor infections, congenital brain malformations, and metabolic disorders. Yes, types of seizures in epilepsy: focal seizures, no loss of consciousness. A person can have a seizure, but is this person is still conscious? Twitching or unusual sensation. You see, complex focal, always altered awareness and responsive. You are not aware, but you are kind of like altered, generalized. You are having general seizures. Those are type of seizures, and they are graded like tonic-clonic, absent, myoclonic, atonic, and tonic or clonic only. Sawa sawa. We go diagnosis. We when we diagnose about epilepsy, we do an ECG, MRI, a blood test. Yes. Treatment, you give anti-epileptic like phenytoin, valproate, carbamazepine, and levetiracetam. Yes, those are prescribed by a doctor, licensed one. You don't buy them by yourself. Or sometimes we do vagus nerve stimulation or responsible neurotransmitter that is bringing the problem. Ketogenic, yes, this is in children with drug resistance epileptic. We do ketogenic. Avoid triggers like sleep deprivation, stress, flashing lights, alcohol, and more. Yeah, that is a complication that can cause a seizure. Let's go to, yes, so we go to the next one, which is traumatic brain injury. A brain TBI, a traumatic brain injury, can cause a seizure. Falls, mostly when you fall and hit your brain, motor vehicle accidents, you hit your head, sports and injury. You play football, watch American football, you get a blow to your head. Assault when you fight, explosive blood. You see, it may be mild, moderate, or severe. It is treated according to the severity of the brain. Now we go on. Now we have talked about epilepsy. We have rushed through it. We go to another complication which may be called Alzheimer's disease. Alzheimer's disease. What is Alzheimer's disease? Hmm? And here we may get even some issues like dementia. Uh, Alzheimer's disease. Alzheimer's disease and other dementia are progressive neurological disorders that affect memory, thinking, behavior, and ability to perform everyday activity. Here, here is an overview. Here, get it here. What we are saying. Hmm? What is Alzheimer's disease? Let's repeat again. Alzheimer's disease and dementia are progressive neurological disorders that affect memory, thinking, behavior, and ability to perform everyday activity. Very important. Alzheimer's disease. Now, Alzheimer's disease is key features may be gradual, gradual, gradual memory loss, disorientation, language difficulty, impairment judgment, personality and behavior changes. Causes and pathology: beta amyloid plaque, protein clumped between neurons. We talked about neurofibrillary tangles, tau protein, loss of neurons and connections. Very bad, loss of neurons and connections. Now, what are the risk factors for Alzheimer's disease? Age, above 65, old age. You see, when you become old, some factors in your body become degenerated. Yes, family history. You may find some people in their families, they have a history of Alzheimer's disease. You see, so you may find you yourself undergoing it. You know, in our family line, we had this history. Yeah? APOE, a gene that is responsible for Alzheimer's. So when you are going to be tested and then you found by APOE, gene 4, you know that we can have this. So you start taking control early. Loss of neuron and connection. Yes, Yes, due to alcohol, take very many things. Beta amyloid. You see, amyloid is a disease. Amyloidosis. Risk factors. We have said about risk factors, and then we go to treatment. Treatment cholinesterase inhibitors, e.g., donepezil, rivastigmine, yes, and antagonists like NMDA, antagonists like mematin. Those are the treatment. And then you do supportive care and therapy, and then you wait for everything. You see, other types. We may go to some other types like dementia, vascular dementia. What is vascular dementia? You see, reduced blood flow in the brain after stroke. So when you have reduced blood flow in the brain after stroke, what happens? What happens is, as you get low oxygen and then you get to dementia, you start forgetting, sudden onset, stepwise decline, the confusion, yes, problem with concentration and organization. You see that? And then we have another one called Lewy body dementia, abdominal deposition all over cyanately. Lewy bodies, yes, visual hallucinations, you start hallucinating. Parkinson symptoms like tremors, stiffness, fluctuating alertness, those ones are in dementia. Frontal temporal dementia, degenerative of the frontal lobe here of the brain, start having degeneration. Behavior, personality changes, language difficulty, younger onset, often before 65. Frontal here, because when you are hit and then you start having complication, you will have dementia. Now we go to general management is cognitive stimulation, structured routine, healthy lifestyle, diet, exercise, sleep. Treat underlying medication condition like hypertension and diabetes. Give Have a supportive caregiver, advanced care. In Parkinson's, in dementia, most, even if we are using drugs, we should have a supportive caregiver, and a caregiver who knows what he is doing. You just not give these people a caregiver. You give a trained or a person who knows what he is doing, because he may confuse some symptoms with the patient being a bad patient. Yes, we go to infectious diseases that may cause you to have depressions. What kind of infectious diseases are we talking about? Here we are talking about infectious diseases like HIV, one, AIDS. We are talking about hepatitis B or C. Second one, we are talking about syphilis, Lyme diseases, COVID-19. You see, these are infectious diseases. Hmm? Like HIV. We all know about HIV. Many people have talked about HIV for so long. What do we know about HIV? There are so many myths that people talk about HIV. And why is it not? HIV is not treated. Let's define HIV. HIV is a virus that attacks the immune system, specifically the CD4 plus T cells of the white blood cell, weakening the body immunity ability to fight infections and diseases. And do you know why they fight these cells? They need that cell to produce their own cells. HIV not multiply, it's a virus. HIV cannot multiply by itself. So what does it do? It goes inside the cells, it copies the DNA of the cell, and then it produces more cells like HIV. You see, we don't talk of HIV virus or viruses of HIV in terms of their fusioning or multiplying. Though they use your virus to create their own cells called HIV. And by this, they are destroying your CD4 cells, types of cells that help your immunity. You get it? When they destroy those cells, they create HIV, their own cells. And that is how your immunity go down. So when do we declare that you are AIDS, acquired immunodeficiency? AIDS is called acquired immunodeficiency syndrome. Where do we do we say you have acquired immunodeficiency syndrome. The most advanced stage of HIV is this AIDS infection, characterized by severe weakening of immune system and occurrence of opportunistic infections or cancers. When you have HIV, you may have opportunistic infections. Remember, I've said when you get HIV, this is what happens. You get one cell of AIDS in your body, it goes to one cell, it is received in one cell, then it uses the DNA of that cell to produce more cells called HIV. And at this part, as it does that, it is killing those cells because it is not producing the cells that they will help you. It is creating another cell called HIV. So your immune cells of immunity are dying while HIV is being created. HIV cannot create itself. It needs your body to create itself. You see, but when we say now you have AIDS, which is acquired immunodeficiency syndrome, is where you have opportunistic infections and cancers have come in because your immunity has gone down. What are the causes of HIV? Most globally, we have HIV-1 and HIV-2. You see, HIV-1 and 2. Mostly HIV-1 is common globally, but HIV-2 is mainly in the West Africa. How can we, is it transmitted? How is HIV transmitted? I know very many people have gone through HIV and we know how it is transmitted. One, unprotected sex with an infected person because you are exchanging fluids and you are getting the fluid. Two, blood transfusion. If you receive blood transfusion that has not been well screened, I'm not, I haven't seen a hospital that can do that, but mistakenly you can receive a blood transfusion that is not screened, you can get HIV. Sharing needles. We've talked about depressive disorders in alcohol and substance abuse. Those people that use heroin and they are sharing needles to inject themselves. Or you are asking for a needle that your friend used to remove something that has pricked you. You see, be careful, you can get it. Yes, from mother to child during pregnancy. That's why our mothers, when they are pregnant, we tell them to go to the hospital so that the child who is inside the womb cannot have HIV. You as a mother, you can be HIV positive, but the child who is inside you is okay. Why? Because the HIV, the blood of the mother and the child, the HIV cannot cross the placenta. You see that? So the child has got her or his own blood. The mother has got his own circulation. So when you deliver in hospital, they know how to prevent the child to get the HIV by your blood and the baby mixing. You see, those are the causes. So when you neglect and do things in a bad way, the child may get HIV. Now we go on. What are the symptoms? Hey, fever. Early stages, you get some fevers that are recurrent. Fatigue, you get fatigued. Sore throat, sometimes you get sore throats that are not going out. You are always sick on sore throat. Swollen lymph nodes. Remember, we have tonsils is part of the lymph nodes. We have auricular lymph nodes. We have inguinal lymph nodes here down. We have lymph nodes even here. Here you have lymph nodes. So when you have axillary lymph nodes that are swelling every time, we should find if you are having an infection or something is happening. But in HIV, you will find these people have recurrent swollen lymph nodes. Be careful about that. Or a rash that is coming and going every time. Every time you are having a rash. Muscle and joint pains is always there when you are sick. Chronic HIV. You see, this is early stage, we are talking about lymph nodes and so and fatigue and rashes. But in chronic HIV, latent state we have often asymptomatic, virus still active but slow in replication. When we are talking about HIV multiplication, the virus replicates. That chronic state, you will find the virus will be active but slow in replication. We have HIV stage where now we consider you as an HIV patient or that person who has got HIV. rapid weight loss, prolonged fevers at night, persistent diarrhea, pneumonia, Kaposi's sarcoma, you understand, TB or recurrent infections. That's why we usually associate tuberculosis with HIV. But I've said here and get it clearly, people that have HIV, it's not always that they will have TB, or people that have TB, it's not always that they will have HIV. Be careful about that. Yes, don't say this one has TB, he'll have HIV. So how do we diagnose HIV? How do we know that this person has this virus? HIV antibody tests, the rapid test that you go to a hospital, they prick you, they get a drug, and then it is tested. In that drug, what is being tested is the antigen antibody, of that HIV. So when it reacts and it comes out with two colors from down to up, yours has been reactive, so you have HIV. We take you to the next step. Western blot or PCR viral. This is the definitive one. We take your blood and then we do polymerase chain reaction to get that virus of HIV in the blood. It is called PCR in viral load. How many viral loads do you have? PCR, polymerase chain reaction. This is the confirmatory one. We get to CD4 count and viral. Yes. We are on very many platforms. If you have a question, please, in any platform that you are viewing from, please like the video on YouTube and at least subscribe as you watch. As you watch, you subscribe so that we may grow. Yes. We are talking about depression in HIV and have gone through the stages of depression. Now, CD4 count and viral load to monitor disease progression. Now, when you have a high viral load, it means you are not progressing well. The drugs we give you for HIV, like the antiretrovirals, they are supposed to stop the HIV from progression, from multiplying, from getting to your cells, the T cells, to get the DNA and copy and produce more virus. They stop that process. So when they stop that process, your viral load comes down. And when your viral load comes down, your CD4 count goes up. So your immunity becomes strong. That is, I've gone through the diagnosis. How do we treat? There are several drugs of HIV according to how the regimen that is there. Now, we have antiretroviral therapy, effective control of the virus, reducing the viral load, restore previous immune function. Now, currently, there is no treatment that has been proved to work worldwide. Although there are some people that have said you take the stem cell from your bone marrow, you transplant. You see, when you transplant, the problem is that you still have the antibody and some viruses that are being replicated. So when it comes up clean cells, what is replicated dies. You see that one is how it goes. Now we will see one day when we'll be talking about HIV in details, how these drugs work and how you can protect yourself from HIV, pre-exposure, prevention. Yes, how can we prevent HIV? Use condoms when having sex with a person you don't know. Very important. Use condoms when you're having sex with a person you don't know. Pre-exposure prophylaxis. When you've just had sex with a person that you've been in a club having fun or in a situation, we know very many situations can happen. We don't do judge anyone. You run to a hospital. They give you PrEP, pre-exposure prophylaxis, so that virus that can grow is suppressed, so that it cannot go inside other cells to start multiplying. So when we stop it from going inside other cells and to stop it from multiplying, here is whereby we say after it has been deleted from your body, you cannot get HIV. You see, regular testing, find out if you are okay. Safe blood transfusion in hospitals, avoid needle sharing, prevention of mother to child through ART, through antiretroviral therapy, and taking the child to hospital. Very important, very important. Global and Kenyan context, 39 million people live with HIV. That was in 2023. In Kenya, adult prevalence is 4.0. Imagine, it's significant progress in treatment, access, and prevention, including widespread ART program and awareness. Now, if a person has HIV, it doesn't mean this person is a bad person. You get it? We fight stigma because it means maybe this person got it from a hospital unaware, working, or through other means. This person can take antiretroviral and live a normal life, because when you suppress the virus of HIV, you see, when, yes, Mark Brown, greetings, Mark Brown. Today we are talking about depressive disorders that may make you be depressed, but we are talking now of about HIV. Yes, yes. Welcome, Mark Brown. Now, if you have a question about HIV or other issue, you can you can you can ask. You can ask. Yes, yes, yes. Yes, we continue. I was saying, I was talking about HIV and how a person had. If this person is having HIV, it doesn't mean this person is a bad person. It means this person can live a good life, because when you're taking antiretrovirals, the viral count goes down. If you have nil viral count, you'll have the antibodies and the antigens, but you see, you are HIV positive, but you are not sick, and you are living a good life. So let's avoid stigmatization in people who have HIV. Support them, let them live like other people, and then we will be good, because everyone fears HIV if you are not got it. But when you are living positive with antiretroviral, you live a good life. You see, the circle of HIV is a big circle, because some people are even born with HIV. Now we go to the other part of some of the, like, we have other virus diseases, other viral diseases. You know, HIV is not the only viral diseases that we know. We have other viral diseases. Which are these viral diseases that we know? Hepatitis, hepatocytes. When you are talking about hepatitis, you think of the liver. You see, hepatitis B, hepatitis C are viral diseases that affect the liver, but different differ in transmission, progress, and treatment. You see, hepatitis B can be caused by hepatitis B virus, a DNA virus. Hepatitis C can be caused by hepatitis C virus and RNA virus. So HIV, we have talked about. Yes, Janet Harris. Janet Harris, welcome to the platform. We are talking about other diseases that may cause depression. And now we have been talking about viral diseases. We have talked about hepatitis, and HIV. So if you have a question about HIV, you can put it on as we continue. You see, now virus diseases like hepatitis C and hepatitis. You see, hepatitis B in the liver, acute, often resolves by its own. You cannot treat hepatitis B, but when women go to women, when they go to labor, and maybe this woman is pregnant, and then we find out that he has hepatitis B. There are some antiretrovirals we give. There are some. Yes, Carole West. Yes, yes. Welcome to the platform. We are talking about viral diseases that may cause depression. So we have talked about HIV. Now we are talking about other viral diseases like hepatitis B. So if you're having a question about a virus or a viral disease, just put it, we discuss. If you are confused about HIV and how it is treated, or you have a myth about HIV, put it on, we see. So here we have hepatitis B and C. If you let's subscribe as we continue, and we continue liking the video. Yes, it makes a person feel confident. Now, often symptomatic but may be chronic. Hepatitis C in the liver may be chronic, and people with viruses in the liver, you will always see their eyes are yellow. Why? Because yellow eyes, they cause what? They are caused by, you remember about the liver talk. If someone is HIV positive and you see yellow eyes, know that the liver is suffering. Red blood cells are dying and producing bilirubin, which is not good. Yes, it should be treated. But you see, here they are saying when you have a virus like hepatitis B, it resolves by itself. But if you are pregnant, we don't want you to pass that virus to the baby. So what do? We give you some antiretrovirals in pregnancy so that you cannot send that virus to the baby. You get it? Yes, very important. But when it is chronic, much higher in infant, we give and we medicate. Now, we suppress viruses, we don't treat viruses. We will have a video where we will talk about specifically about viruses and much more about the HIV virus. Now, we are going to symptoms of viral infections like hepatitis C and B. Symptoms: fatigue. You are always tired, fatigued. And then the second one, you have jaundice. When you have tired and your eyes are yellow, we call it jaundice. And I've said the yellowness of the eye comes because of the yellowness of the eyes come because of bilirubin that is not conjugated, the bilirubin that is not broken down. Abdominal pain. Yes, the liver is suffering and you are feeling abdominal pain. Dark urine, very dark urine. Nausea and vomiting. These are the symptoms that you may have when you're having these viruses, hepatitis B and C. So when you hear someone saying you have hepatitis, always think of the liver, because liver in medical terms is called hepatic system, and the cells of the liver are called hepatocytes. So hepatitis is infection of the liver. We go to diagnosis. How do we diagnose these viruses of the hepatitis C? Hepatitis V, we can do polymerase chain reaction or the antigen antibody test. That is the key thing we can do. Prevention is always prevention. Vaccine available for hepatitis B. Hepatitis C, we don't have any vaccine. What are the complications of the virus? The HIV virus and even hepatitis C. You can get liver cirrhosis. The liver can have some form of cancer, cirrhosis, liver failure. Your liver can fail, or you can have the hepatocellular carcinoma. You see, now we are talking about this virus, the virus. We have talked about these are infectious diseases, diseases that you can be infected directly or indirectly by. Directly, it means you are associating and exchanging body fluid to a person who has the virus. Indirectly, by using something that someone has used and is transmitting this virus to you, that is indirectly. So these are, yes, we go to other infectious diseases that are complicated and they make a person go to depression. Syphilis. What is syphilis? We all talk about syphilis. If a person goes to hospital and you take urine. When you take urine, you are told you have an infection. What are the signs that may show this is not just an infection, but a sexually transmitted disease? There is a difference between a sexually transmitted disease and a normal urinary tract infection. You see, sexually transmitted disease are sexually. You get sexual active, you do the act, and then you get it. But urinary tract infection, you may get it through your clothes that you've worn, sanitation, in the toilets that you use mostly for women. So you kind of like separate the two. So syphilis is an STI, sexually transmitted infection. Syphilis can make you go depressed and even get mental issues. Let's see what is syphilis. Is a sexually transmitted infection caused by a bacteria called Treponema pedila. It's a bacteria that causes syphilis. It progresses in stages and can be severe complicated if left untreated. If you leave syphilis untreated, you can be psychotic. It can interfere with your brain. You see, we have said it's a bacteria. Mode of transmission. Syphilis can be transmitted sexually, vaginal, anal, or oral, because there are some people who have syphilis even in the mouth. You see, they survive to the mucus layer. Your mouth is a mucus layer. So it can stay in your mouth. When you go to kiss a partner that you don't know, and this partner has been having oral sex with someone else, that virus can be, or that bacteria can be carried from that person to you through the mouth. Nowadays, we have very funny oral sex. You know, the DJ, everything that you know. And then you are coming to kiss your partner at home, and your partner has been kissing someone who this person he don't know or she don't know. You see, that is, we call it sexual contact. And then we have vertical transmission. Vertical transmission is whereby we see a mother who is pregnant, has syphilis, and the baby gets it. That is vertical transmission. Direct contact. When you're having a person with some sores we call them some wounds, and then you are trying to help by touching them, the chanka, we call those sores the chanka, and helping, and you are touching yourself all over. Be careful. You see, that bacteria may come and get into you. You see, that is called direct contact or the chancre. Syphilis has stages. It has primary stage, painless chancre. That boil that comes in your penis or the vaginal lady that is not painful, be careful about it. The chancre is not painful. In secondary, you get, after that you will get a rash. A rash. You will know you're around your palms, your sores, you get a rash because now it is getting multiplied and multiplied. Latent stage. It reaches a place where it has no now any symptom. It is still incubated, but you are after the rash, it is still there. Tertiary occurs later. Now the stage goes to neurosyphilis. You get dementia because it has gone up to your brain. You have started urinating pus. When syphilis gets to your brain, you become psychotic because it goes to the basal ganglia and destroys your brain. So we have said the kissing and kissing and kissing that you do with people you don't know, stop it. Touching of wounds that you are not aware of and what they are, stop it. Syphilis is a bad thing. Congenital syphilis from infected mother to the fetus. This may cause the fetus death. The fetus might die because of the bacteria. Snuffles, nasal discharge. You start removing discharge from your nose because of a bacteria and you kissed someone that you don't know. Imagine. Just imagine. We stop kissing. We stop oral sex to people that we don't know. We start having a clean sexual behaviors. We go to clubs. Our Gen Z children, I've seen them saying they are doing it in blowjobs. No, stop it. You don't know where that person was. Very bad, very bad. Saddle nose, sabashins, Hutchinson's teeth. You have kids like they are protruded like this because now the bacteria is disturbing the oral cavitation. Syphilis. You see infectious disease, and then when you are in this stage, you start being depressed. Please, when you get a chancre is a sore or a pimple that is not painful on your penis or vagina, ask your doctor, sorry. But when you have a painful pimple, at least be relieved. And painful chancres, and you've been having sex with unknown people, you know what may happen. Yes, I'm just advising, and I've said kissing people that we don't know, stop it. Now, diagnosis of syphilis is always antigenic. We do the antigen antibody test, or we can do the polymerase chain reaction to see the bacteria. What are the complications of syphilis? Because syphilis may have a complication. What are the complications of syphilis? These are infections that may stay in your body, and then you get when they stay, you get depressed because they are not healing. Now, permanent organ damage, that bacteria can lead to heart failure, that bacteria can lead to brain death, that bacteria can lead to liver abscess. Liver abscess is when you have pus that is filled in your liver because of the syphilis. Infectious diseases, increased risk in HIV transmission, because now listen, you are having sex with the person who has a chunk of syphilis which produces sore. So when you get there, what do you get? You are exchanging direct blood, and you see sometimes the layers of the vagina might help to stop you from getting the HIV, but these layers are open. Now, how can we prevent the syphilis? Use condoms always. Stop kissing people that you don't know. Now you end up getting syphilis and you've not had sex. Imagine. Just imagine. Because you kissed someone that you don't know. At least kiss a person that you know the sexual health and behaviors. Yes, sanity, clean. You feel good and she feels good. We go home happy. Very nice, very nice. But we don't want syphilis. Parental screening for all pregnant women. When pregnant women go to maternity, and when they go to antenatal care, antenatal, before you conceive, you have to be screened on syphilis so that you cannot pass it to your child who is innocent. Hmm? Hmm. Yes, so that you cannot pass it to your child. Welcome, welcome, Roger Killer. We are talking about infectious diseases that makes people to go to depression. Now, if you have any complicated question about what I'm asking, put it on. Let's talk about, maybe you have a friend that you've been confused if he can heal, or this person got syphilis and became depressed, or he became like psychotic. You ask the question. Yes, 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 yes. But we have said no kissing of people that we don't know. Yes, there is another infectious disease. Now we have come from syphilis. Syphilis is always treated by high antibiotic, because now if you get syphilis is a bacteria, complicated to treat. You'll be treated like for 14 days before you get better. So you've seen how syphilis go. If you see your daughter, your son bringing 1, 2, 3, 4, 5, 6 ladies and men around, talk to them about this. Tell them about syphilis, and you've seen syphilis can come with HIV/AIDS. So if syphilis can come with HIV/AIDS, my people, just imagine. And then you'll be psychotic because of kissing someone and you did not have sex. Very bad, very bad. Oh my God, very bad. Please like the video. Bring those questions. Let's interact as we go. I answer the questions. You see, don't just listen. Listen and help a friend. Yes, Evelyn, Minage, Roger Killer, everyone in the platform. Listen and help your friend, because we are losing so many people. We are losing so many people with this problem. Lyme disease. We are talking about infectious disease that may cause depression. Now, there is Lyme disease. It's an infectious disease caused by bacterial bedogophy. Yes, it's still a bacteria transmitted by human through a bite of a mosquito. And not a mosquito. That thing is a tick. Through a bite by a tick, known as deer tick. So when you are a farmer, you like farming, and then you have ticks, be careful. Yes. This in North America, they are there. And in North America, in Europe, you will find these people are suffering from Lyme diseases caused by spirochete bacteria. You see that in the US. Lyme disease in Africa is not so much, but in the US, It is there because of that tick. What is the pathophysiology? What does this tick do? If you have a friend who has been affected by Lyme disease and all this, please bring that question. Let's work out about that question. Once in the body, you see that ticks bite you and it presents that bacteria in the body. Spirochete spreads locally in the skin and may disseminate through the bloodstream and lymphatic system to the joint, heart, and nerves. This bacteria called Borrelia burgdorferi, may go to your bloodstream, and then it goes to your joints and heart and nervous system. My friends, we are talking about issues that may make you do what? Have depression. We have talked about infectious diseases like HIV, AIDS, syphilis, all those. The neurological diseases like dementia, Hmm? like dementia. Roger Killer, diseases are bad. So if you are nothing you fear, listen to this, listen to this and help a person. Like about HIV. Talk to people out there about how to avoid HIV. Syphilis, you've seen, you can get it even by kissing. So you talk to them. Talk to them. That's why I'm here. I'm here to educate and to help. Now, we are going to Lyme disease. Lyme disease, you see it through the bloodstream and then it goes to your joints. It has some stages. Early stage, when you are being bitten by people that are in the US, mostly Europe. Be careful. Be careful about ticks. Early stages, when the second stage, when early disseminated stage, multiple rashes, facial palsy, meningitis symptoms, stiff neck. You see, when you have stiff neck and you've been bitten by a tick, be careful. Late disseminated state. We talk about arthritis. Arthritis. Hmm? Arthritis, yes, arthritis. Imagine you have been bitten by a tick, you have been bitten by a tick and then you get arthritis. And then you go get encephalopathy. Encephalopathy, you get brain dead because of being bitten by a tick. Sanitation. Lyme disease is sanitation. How do we diagnose Lyme disease? ELISA, two-tier Western blot. We take blood to the laboratory, we do this test called ELISA and Western blot. And then treatment, we treat them because it's a bacteria, we treat it with doxycycline, amoxicillin, or cefuroxime, according to the drug of choice that your doctor will need. Prevention, we prevent, avoid ticks infected area. When you go to ranches, we've gone to visit ranches, please be careful you don't carry ticks to your home. You may get Lyme disease. Wear long-sleeved pants. Perform full body tick checkout. Those that are farmers, if you are home there and you are farmers, please be healthy and take sanity of your cows and all those animals you live with. And that's why taking your cows and pets in the house, pussycat, cats and dogs, you wash them, let them not have ticks. You see now ticks can bring Lyme disease and it may end up you having brain death and what encephalopathy is brain death and arthritis. Arthritis, we will talk about arthritis. So what is Lyme? Hmm? Karen White, Rogers, although learning from COVID, is indeed goes around giving. Hey, Karen White is a funny lady. No, Lyme disease is we have a synonym called lymphadenopathy, yes, the bull's eye, and migratory arthritis and erythema. Now, let's go. Carolite is making me laugh. Now, let's go to COVID-19. Let's learn. We all went through COVID. What was COVID-19? And is COVID-19 still there? And you see, COVID-19 gave everyone stress and depression. I'll go roughly faster on it. It's a wide topic, but what is COVID-19? COVID was called Corona Disease 2019. Is a contagious, mm, it's a contagious respiratory illness caused by SARS-CoV-2 virus. That's why it was called COVID-19, but the virus itself is called SARS-CoV-2 virus. Severe acute SARS, it means severe acute respiratory syndrome virus 2. It was first identified in Wuhan, China in December 2019. Imagine, in December 2019. Cause and transmission. Transmission, spread. This one, COVID is spread primarily by respiratory droplets, coughing, sneezing, and talking. You imagine you are around a person who is talking and removing a droplets, and this person has COVID. Aerosol in spaces. You see, that is not good. Surface. I have just touched my mouth and I'm touching in surfaces, and then you come and touch, and then you do like this, but it's less common. Incubation period of COVID is 2 to 14 days, 5 days. Symptoms of COVID: fever or chills, dry cough, fatigue. If you have a question, members, just ask as we go on, about to finish. Headache, muscle aches, sore throats, sore throats, nasal congestions, nausea and vomiting. And you see, because it's a virus, we will talk about viral pneumonia. It can cause pneumonia, acute respiratory syndrome, thromboembolism, and even multiple organ failure. You understand at the time of COVID, many people became diabetic. We will know why one day as we go on to learn. Diagnostics: PCR, rapid antigen chest test, and then we do chest X-rays. We do chest X-rays to confirm. Treatment: it's a virus, my friends. We don't use antibiotics unless this person is infected with a bacteria. We give oxygen, dexamethasone as a relaxer, antiretrovirals, easy remdesivir, they will help relieve the symptom. Monoclonal antibodies like sotrovimab, they will help relieve the symptoms, and anticoagulants to make the blood not to clot. Vaccination. You remember, everyone needed to be vaccinated against it, so your body can know how to fight with those viruses. And then we have viral vectors, inactivated virus, all those are vaccination, but not everyone needs to be vaccinated. Ask your doctor if you are viable to be vaccinated. We have talked about COVID. Now, other diseases that may bring uh, 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 conditions that may bring depression are like endocrine and metabolic. I'll go to this faster because my time is about to finish. I go to another session. Now, hypothyroidism. If you have a person who has hypothyroidism, just know it can bring depression. Please like the video as we continue. Share the video, please. We need likes, we need a subscription so that we may grow. Hypothyroidism is a condition which the thyroid gland does not produce enough thyroid hormone that can T4 and T3. It can cause. I'll go to this faster. If I go to this faster, if you have a question, you ask. Now, hyperthyroidism is the opposite of hypo, where it is producing more hormone. Then we have Cushing syndrome. These are endocrine issues that may cause what? May cause this problem. Endocrine issues like Cushing syndrome. What is Cushing syndrome? I want to finish today related issues. Cushing syndrome is a hormonal disorder caused by prolonged exposure to high levels of cortisol, glucocorticoid. You remember the steroid I talked about that is being produced from your brain. Yes. Addison's disease. Cushing syndrome is high cortisol. What is Addison's disease? Have you ever had a family member that has been diagnosed with Addison's disease? Let's get to know if we ever had a family member. We discuss, we talk, we help you, we help someone else. Addison's disease is a rare diagnosis whereby adrenal glands fail to produce enough cortisol. It's the opposite of Cushing syndrome. We have diabetes mellitus. Diabetes mellitus. What is diabetes? I think I'll have one day whereby I'll have to talk about diabetes alone, because many people are diabetic and they don't know why they are diabetic. This is a day that is coming. I'll have to talk about diabetes alone. It's a chronic metabolic disorder. This is diabetic mellitus, characterized by high glucose, hyperglycemia resulting in defect in insulin secretion, insulin action, or both. You see, insulin secretion, insulin action, or both. That is diabetes. And what if you have vitamin B insufficiency? You are not eating fruits, you don't like eat several fruits, or you see, what can vitamin B insufficiency bring? Yes, we give women when they are pregnant vitamin B. Yeah. If you are rare, a condition whereby red blood cells are large immature due to impaired DNA synthesis. Although they share many features, their key function, you will be anemic because your red blood cells are not functioning. You will be anemic. Okay. We are go to the. I'm just going through the complications. The other complications that may make you have problems is like chronic heart failure, coronary heart disease. These are issues that target the heart. Chronic obstructive pulmonary disorder, COPD, we have talked about it. You'll go through the video. Sleep apnea, when you are sleeping and you are not getting enough oxygen. Who might Mark Brown, you might start to send kisses via social media to your partner. That is better. That is better because you will not have contact, Mark Brown. Higher. Let's continue. We have seen when you're sleeping and you're having sleep apnea, it's a problem because that can bring stress. Autoimmune diseases like SLE, rheumatoid arthritis, these are things that we will talk about. Others are like cancer. What do you understand? Let me ask this question. What do you understand by a cancer? A cancer. How can you say what is cancer? Because when some people are told they have cancer, they have cancers, they become stressed out. There are two types of cancers. There is benign and malignant. When I'm talking about benign cancer, I'm talking about a cancer that is specific place and is not going somewhere else. But when I'm talking about malignant, that is a cancer that is spreading through your body. So a cancer is a group of characterized and controlled growth and spread of abnormal cells. If the spread is not and is controlled, it can result in death. You see that? That is a cancer. A very simple thing to describe a cancer. A cancer is a group of disease characterized by uncontrolled growth and spread of abnormal cells. If the spread is not controlled, it can result in death. It can rise it almost tissue of the organ. We will one day talk about cancers and we will know why it is hard to treat a cancer. If you have these questions and you have a person who has ever suffered from cancer, we will see how and why. There are several types of cancers, and the two subdivisions of cancers I've said are two is benign and malignant. Benign is when this cancer is not spreading, it's not spreading, but malignant is when the cancer is spreading. You see, there are several types of cancers: carcinoma, sarcoma, leukemia. Carcinoma, it attacks the epithelial cells, e.g. the lung, breast, or colon epithelial cells. Sarcoma, connective tissues, e.g. bone, muscles, and fats. Sarcoma. But leukemia, blood. When you hear about leukemia, you think of blood. Lymphoma, lymphatic system, the lymph system. Myeloma, plasma cells in the bone. When you talk about myeloma, think of the plasma cells of the bones. When you talk about melanoma, melanocytes, cancer of the, these things we will learn about them slowly as we go on. And I've got so many requests to talk about cancers. We are still working on the program of cancer because it's a wide topic. What is the hallmark of cancer? Sustained proliferation, evident growth suppressors, resistant cell death, enabling replication motility, induced angiogenesis, reduced blood supply. You see, we will see one day why cancers are. Now, we have talked about cancers, chronic pain syndrome. You are just having pains chronically, always pain. Be careful. Anemia, yes, we will see. One day we will talk about anemia. Have you ever been diagnosed with anemia? Have you ever gone to a hospital that you're told you have anemia? We will know why. And you see, when you're told you have anemia, you will start having depression because anemia comes with chronic dizziness. You are always dizzy. You don't have strength in your body. You see, liver failures, they are diseases. So when we have talked of so many things and I've gone through some because of time and management, you will see, treat the underlying medical condition first. Treat the underlying medical condition. If you have an underlying medical condition, it's not all that we to treat. You can manage like HIV. We've seen how HIV is. We give drugs to suppress the the virus. You do what? You suppress the virus so that this person may live positively. Hey, give this person antidepressant if this person is depressed, and then psychotherapy. You see, psychotherapy, supportive therapy, collaboration between other people and other programs. We have talked a lot about several things: HIV, AIDS, Alzheimer's disease, all of those. These are the problems that may cause you to have what? To have depression. So what I'm saying is, from next week, we are talking about other things. Depressive disorders we have done. Unless someone has a question on depressive disorders, according to the video, we will be asking. So next week, we are talking about sexual disorders and gender dysphoria. There are some people who have sexual disorders, and sexual disorders is not only sleeping with someone and you cannot manage or you are not being satisfied. It's a very huge topic, and we will see how sexual disorders are and come out. And then we will talk about gender dysphoria, because gender dysphoria is another topic of interest in mental health that you see. You see that? So tomorrow I will see if we will start with sexual complications in mental health, and then we continue to gender dysphoria. Someone is asking me what is the gender dysphoria. We will see what gender dysphoria is. But I can say gender dysphoria is significant distress or impairment due to mismatch between their assigned sex at birth and the experience or expressed gender. You understand that gender dysphoria, where a person experiences significant distress or impairment due to a mismatch between their assigned sex. You were born and you are told you are a man, you get it, at birth. And but when you grow, you have experiences of a lady. So we will see what happens. What happens to this person that is supposed to be a lady but now is behaving like a man, or a person who is that supposed to be a man, but now he has decided I'm a lady. That is called gender dysphoria. It is not, we should not stigmatize these people. It is a medical condition. It is characterized in DSM-5, yes, and it is something that we will talk about. There are some people you've seen, you live with people that behave like ladies and they are men. You live with people that are men, but their sound and how they behave is like a woman. You get it? That is called gender dysphoric. And then we will see next week. No, not next week, tomorrow. Tomorrow, if we have time, we will deal with those two things. And then we will deal with sexual problems. You get it? That is the topic. I'm seeing people are getting surprised. Roger Killer, what is surprising you with that? Mark Brown, I know you've met a person that has had this problem. You meet a man who is talking like a woman, but when you look at this man is a man. Hmm? And then we will go, you see, that's what is sexual dysfunction. We will talk about sexual dysfunction. Let me highlight them so that we may end the day. What is sexual dysfunction? Please hit the like button, share my videos, and then we go on. We help someone psychologically and let the mental health be okay. Yes. Sexual dysfunction refers to the problem that consistently impairs a person's ability to experience satisfaction from sexual activity. These disorders can be affected desire, arousal, orgasm, or painful intercourse and may occur in both men and women. You get it? Sexual dysfunction. You don't have desire. You are not aroused. You cannot get an orgasm. There is pain during intercourse. You get it? And may occur in both men and women. Imagine, my friend. Just imagine. When you want the pleasure, but it's hard for you to get the pleasure. Just imagine. Hmm? So next we are going to talk tomorrow. If time allows us, we will talk about gender dysphoria and we will talk about sexual disorders. Now I've talked a lot about HIV. People have laughed about syphilis and kissing. There are things that happen. It's do or have English, not my. No, if you have a question, just ask before I log out. I've talked a lot. I've seen Mark Brown is very surprised about. Hmm? Hmm? I'm reading some comments that are being sent from other platforms, and I'm really happy about how people are commenting. How people are commenting. Yes, yes, yes. Yes, Simon, acha nikupigie kidogo tu. Okay, okay. Now we I think we will if you anyone has no question, the people who are on other topic, tomorrow we are going to talk about it. Tomorrow tell people we are going to talk about these funny topics that you are hearing about. Yes, Rogers, what are you asking? Repeat again, please. What is your question? I'm not avoiding it. What is your question? Type again. I'm waiting. What I cannot avoid your question, please, Roger Killer. Please, I'm waiting for your question. I'm waiting for Roger's question. Which is the question? I've missed it. What is the question, Roger? I'm waiting. Post it. Post it. I wait. Post it. I'm waiting. I'm waiting your question, Roger Killer. Roger Killer, I'm waiting your question. I have 6 minutes to go. I'm going to attend to a patient. I have 6 minutes to go. Mm. Rogers, I'm waiting. Let me see. Yes, yes, yes. Please, Mark Brown, tell Rogers to resend the question. Rogers is very excited to hear about kissing and so. Mm. As Rogers is shy on asking questions. Rogers is shy, or any other person. Where is the question? I'm not seeing it, Rogers. Where is it? Where is the question? Where is the question? Where is the question? Yeah, has anyone seen the question that Rogers has sent? If anyone has seen any question that Rogers has sent, please share it. Please resend your question, Rogers. It may help someone else. I have done so. I don't know what is wrong if you are not seeing it. I've not seen it. I've not seen your question, Rogers. Please just do. It may be a good question that may help someone else. You know, we are all learning. We are all learning, and your question may help someone else. Let me see. Let me see. No, I'm seeing your comments, but I'm asking the question. What was your question? I'm going through the. Has anyone seen the question? Please help Rogers. Or if anyone else have a question, you can ask. Because what I'm seeing is it's do or have English, not my mouth. That was what I'm seeing. And I'm seeing. Okay, I have 2 minutes to go. I have to go and attend to a patient. Please resend the question, Rogers. I'm waiting. I have 2 minutes. I'm not sure about the question of Rogers. Is anyone in the platform seen the question? Please repost the question that we can tackle it. I have 1 minute now. I have 1 minute. repost it. We can help. You see, a question from someone may help someone else. Rogers, I'm seeing your comments, and everyone is seeing your comments. The problem is we are not seeing that question that you've asked. That is the problem, and we are waiting for it. My time is out. I have to attend to a patient. It's 1 hour, 30 minutes. Thank you all for coming to the platform. Tomorrow we will deal with gender dysphoria. You have seen what gender dysphoria is, and we will deal with sexual dysfunctions. So if you have a question on sexual dysfunctions and what we have talked about, gender dysphoria, you may bring it tomorrow so that we discuss. Our time is always at 4 African time. Thank you so much for everyone who has been on the platform and participating. It has been a good uh, communication and learning process. May you be well. May you be well, and let's meet tomorrow, the same time. Roger Killer, Caron White, all that has come for support, please hit the like button and share, and then we grow together. Thank you so much. Have a nice day. I always say, love is my religion. Let's love and be cool. Nice. Bye, guys. See you tomorrow at the same time.